If you were to break your leg, what would you do? I'm assuming that your answer would be you'd go to a doctor and you'd get help because that's what you do and it makes sense. What do you do if you're struggling with a mental illness? One of the least common answers is to get help. Why is it so common for people to avoid getting treatment for their mental health? Globally, more than 70% of people with mental illness receive no treatment from healthcare professionals. Evidence suggests that factors that contribute to treatment delay or complete avoidance include lack of knowledge to identify mental illness symptoms, inability to access treatment, prejudice against people with mental illness, or fear of being discriminated against for seeking mental health treatment. This is a result of the mental health stigma. Mental health stigma is the discrediting of one's status, behavior, or identity as a result of mental illness and is considered the most debilitating aspect of mental disorders. Furthermore, it is a legitimate barricade when it comes to seeking treatment. Essentially, mental health stigma is a communication error. The cognitive theory helps clarify the etiology of mental health stigma. This cognitive model explains how people's perceptions or unconscious thoughts regarding their situations influence their social, behavioral, and psychological reactions, resulting in cognitions. Cognitions are intertwined with schemas, the major knowledge structures that help people think and organize. Thus, people's prejudice against those with mental illness are stored in their schemas. Additionally, this can be influenced by someone's upbringing, such as the false belief that people with depression are just lazy, being passed from the parent to the child. It is unrealistic to assume that mental health stigma will be completely eliminated from society, but it can be reduced. Integrating mental and physical health services would normalize prioritizing and checking up on mental health. Moreover, it would educate parents and children of warning signs of mental illness. Because mental and physical health are fundamentally linked and often affect each other, combining both services would further benefit patients. Additionally, raising awareness is necessary to make any progress on the reduction of mental health stigma. This can be done over social media, implementing educational programs in schools, and through healthcare professionals. That being said, raising awareness properly and effectively is important. For instance, refraining from dramatizing or glorifying mental illness in ways that some movies or articles have done in the past. Doing so would reframe the way that people view mental disorders, normalize talking about mental health and seeking treatment, changing false schemas, and reducing the adverse effects of mental health stigma.